How easy was it when you made that decision to get involved in the discussion? Because I look at meetings now, I can talk to anyone at a
Yeah.
meeting and I say Bill Wiley, and they go, "Oh yeah, Bill Wiley. He's like he just
Thanks.
presented inverted implantation of an IOL," and people just implicitly understand, oh man, Bill Wiley always trying out new things, trying to innovate and improve outcomes. And but I would imagine rewind time back to when you're 30, 35, and just realizing like, hey, I actually have a lot of experience, and some of these people, they don't really know what they're talking about. How easy was it to get involved with that discussion? Because I think a lot of young ophthalmologists who want to give back, who want to contribute, who want to be a part of the community that's growing things, they often wonder, how do I get a seat at the table? Or
Yeah.
how easy was that for you?
I feel like if you're willing to do the work to gather, let's say, the data and present your findings, it's one of the easiest way to get your foot in the door. That it seems like every few months there's a new product launch. Let's say Vuity, for example. Allergan is starving for data on Vuity. And if you're a young ophthalmologist that has used Vuity, and even let's say 10 patients, okay, well, how did they do? What was their response? How are they seeing distance, intermediate, and near in a true clinical practice? How were they post LASIK patients, or the cataract patients, or were using it on label or off label? There's so many questions that need to be answered with a product like that, and there's so much opportunity to simply just gather the data and present it. Submit a presentation at, let's say, ASCRS or Academy or any Care BNI or ACOS, any one of those meetings would be happy to have that data presented. And then what will happen is Allergan will take notice. They're like, oh my gosh, look at, Arjan just presented this data. Looks very interesting. You know what? The next time we have, a booth at Academy, we'd love for him to present his, findings at the booth. And then you do a booth talk and people realize or take note. And then they say, okay, well, you know what? There's going to be a meeting in, ACOS, and we'd love to support you to present your findings there. They might sponsor you to go out to that meeting or whatever it might be, or the next new drop that they're working on. Their research department is like, well, he did such a great job in that Vuity IIT, or even that just self-funded study, that we should support their research department or research efforts to go to that next level. So it starts with more or less sharing your clinical findings and thoughts, and then that sort of snowballs, and there's plenty of opportunity. I think just to sort of say, well, I just want to be invited to speak because I think I know a lot about it. Yeah, that might be hard to do. But if you gather the data, put it out there, I think that's when you start to get those opportunities.